Common symptoms of OCD. Hi, I'm Michelle Risser, and I'm a licensed therapist specializing in perinatal mental health, including OCD. Let's go over common symptoms of OCD. In this video, we'll discuss what is OCD, common OCD obsessions and compulsions, signs of OCD in children, teens, and adults, and getting an OCD diagnosis. What is obsessive compulsive disorder, or OCD? OCD is a neurobiological and heritable disorder. Some consider it an evolutionary biological disorder that affects about 2.5% of the world's population. OCD is likely underestimated and misdiagnosed. OCD is often referred to as the doubting disease. The hallmark of OCD is uncertainty, which provokes anxiety. People with OCD experience unwanted, intrusive thoughts, images, or impulses that provoke the need to be certain that their thoughts have not caused negative events to occur. OCD compulsion rituals performed as attempts to make the thoughts and anxiety go away are done out of a sense of moral duty, that if there's something they can do to prevent harm, then they should. These attempts never work, since they only reinforce the power of the obsessions and fear. Fortunately, there are treatments that are effective no matter how long a person has had OCD or the level of severity. OCD symptoms. The cornerstones of OCD symptoms are obsessions and compulsions. These obsessions and compulsions take a large amount of time in someone's day. Obsessions can distract people for long periods, and compulsions can take hours to perform. The four most common categories of OCD obsessions are contamination obsessions and washing or cleaning compulsions. Contamination OCD is characterized by a fear of spreading germs, getting sick, or getting others sick. Obsessions about causing harm or making mistakes and checking compulsions. Harm OCD includes a fear of being negligent or careless, resulting in a catastrophic event like a house catching fire or accidentally using poisonous chemicals. Obsessions about order and symmetry and ordering and arranging compulsion. Just right OCD is characterized by the need for everything to be in order. This can include superstitious fears that something out of place may be bad luck, or experiencing a not right feeling without an obsessive fear. This is also seen in symmetry OCD. Obsessional thoughts concerning sex, religion, and violence, for which mental undoing or thinking good thought rituals are performed. These obsessions could include intrusive pedophilia or rape obsessions leading to an avoidance of children or public places, images of stabbing someone that lead to an avoidance of using sharp objects, blasphemous images of religious icons, or of committing an unpardonable sin that compels religious rituals or avoidance. Common OCD compulsions. Compulsions are deliberate physical or mental behaviors that are performed to reduce anxiety, fix or undo intrusive thoughts, prevent harm or bad luck, or relieve discomfort. Rituals. Compulsive rituals are behaviors or a series of behaviors that a person does to counteract the obsession. These rituals may continue until they feel just right or achieve some other goal. Examples of OCD rituals are endless and can include things like turning lights on and off, organizing or lining up objects, touching items in a certain way or certain order, completing a certain routine before leaving the house, eating specific foods in a specific way, or avoiding cracks in the sidewalk. Checking. These compulsions involve checking and rechecking certain items, usually to ensure a sense of safety. Checking compulsions can consume a great deal of time. Examples of OCD checking include making sure the stove is off, making sure the doors and windows are locked at home or on the car, checking on loved ones, making sure the water isn't running, making sure food is still fresh in the refrigerator, and checking on pets to make sure they have food and water. Correcting thoughts. Correcting thoughts can be a form of mental compulsion. Rather than engaging in an outward behavior, these compulsions are invisible. Examples of correcting thoughts could include counting, reciting words or phrases, repeating instructions or directions, repeating thoughts and situations like crossing the road or getting to the car. Seeking reassurance. Often compulsions only involve the person with OCD, but seeking reassurance works by bringing another person or several people into the routine. For example, this could include asking someone if they think that the house is safe after already checking the lock. Other examples of seeking reassurance in OCD include asking for compliments, asking for confirmation that a situation is safe, seeking reassurance that they are a nice, smart, or kind person, or wanting confirmation that hands, house, or foods are safe and clean. Signs of OCD in children. Children with OCD may have trouble moving moving from one task to the next without performing some kind of transitional routine. They may become perfectionistic and rigid about schoolwork or other activities. They may be fussy about how things are arranged or about cleanliness. They may have limited foods that they eat or very specific rules about eating, and they may have the need for things to be done in the exact same order every day. Signs of pediatric OCD include rule following, perfectionism, arranging, being late for school, demanding that family or friends repeat something a certain way until it's said right, wearing holes in paper from erasing due to perfectionism, problems taking tests because of a need for certainty that the answers are perfect, or feeling stuck, or having trouble with time management. Signs of OCD in teens and young adults. Late onset, according to some researchers, is said to begin from the age of 13 to 23. Young adults are coming into their own. Issues around separation, identity, and sexuality are prominent themes. The stress of going away to college, becoming independent, and moving away from family, and other events that occur during these stages of life can trigger the first episode in people who are predisposed to OCD. Signs of OCD in teens may include a sudden need for dependency, avoidance of social events, including dating, seeming withdrawn and anxious, asking repetitive questions for reassurance, requests made to accommodate the OCD, such as imposing OCD-type rules in the household, and incomplete school assignments. Signs of OCD in adults. Adults may experience symptom interference with their family and work obligations. Obsessions may change over time or during a new episode. Potential signs of OCD in adults include being late for work, being slow at work or not meeting deadlines, perfectionism, trying to have control beyond one's duties, frequent bathroom breaks for hand washing, an overdeveloped sense of responsibility in the home or workplace, missing out on family time, and needing control or setting OCD rules in the household. Getting an OCD diagnosis. Looking into your symptoms is always helpful, but only a mental health or medical health professional has the education and experience to make an official diagnosis. You can begin by talking to your doctor or your therapist about your symptoms and concerns. From there, they'll ask you a series of questions or offer you a rating scale to measure the degree of your OCD symptoms. Even if you don't have OCD, you could have anxiety or another related condition that causes distress. This professional can help. Final thought. Although there is no cure for now, OCD is a very treatable problem, and fully engaging in treatment will give you a level of control over your symptoms, and you can achieve a meaningful and long-lasting recovery.